So I was working in QC for a biotech company, and it just got much more corporate. It had been a nice little comfy startup, and there was a job going for associate practitioner in molecular pathology here as part of the 100,000 Genomes project. And I thought, oh, I want to go back to where I thought I was going 10 years earlier, and applied, and I was lucky enough to get it. And then the department have supported me in applying to be a clinical scientist. I've spent some time, did a master's before the current one, and was accepted onto the programme. So because I'm a trainee, I'm technically supernumerary, which means I get to do all sorts of different bits as they fit in with the training requirements, which is lovely because Cancer Genomics is very intersectional, so I get to work with histology, I get to work with haematology, I get to work with bioinformatics. And that means that on a given day I might be in the lab learning how to do something, I might be with a clinical scientist looking at the reporting, I might be writing up training plans or attending conferences. So UHS has a really good employer culture. Again, it was a bit of a toxic environment in my previous role, and one of the reasons I've loved working here is my department are very supportive. They bought me flowers for my wedding, And there's also some great employee perks, so I make use of the employee nursery, which is actually incredible. So if you're looking to get into the clinical scientist training program, it is very tough. Do not take it personally when you don't get there first or even the second time. But look for applied experience, basically. You're looking to get NHS-related or healthcare-related experience, as well as something higher than your undergraduate qualification. But absolutely do go for it. The field is growing and it's exciting and it's going to make a difference, so go for it. So short term, I've got 2 months left to finish my master's project, and then I've completed the master's aspect of my training, and about a year to my final exit exam. So short term, I'm working on completing all of my accreditation requirements and getting ready for that exit exam. Longer term, I'm hoping to continue working at UHS, and I'm hoping they might have openings in training officer or quality lead roles, because that's an area I really enjoy. I might even consider doing the higher level clinical scientist if I'm insane in a couple more years.